This is Dr. Dan, board certified pediatrician, and welcome again to Is That Normal? Today's topic, is it normal my kid has a fever? Fever is one of the most common reasons, if not the most common reason, that patients and parents call pediatricians. But there's some very important things to remember about fever, and that includes 1, the age of your child is important when they have it. 2, fever is merely a symptom. And 3, there is a lot of literature saying that we may not even have to control fevers. But we'll get into why and how as we move through this. So first of all, fevers in very young infants, kids under the age of 2 months, are much different than at any other age. But the reason for that isn't that the fever is dangerous. It's that the fever is merely a symptom, and in a baby less than 2 months old, it is very difficult to tell, even if you're the best pediatrician on the planet, whether your child has a serious illness or a viral illness that they can fight off on their own. So we take fevers under the age of 2 months very seriously. In fact, I tell all my patients, the temperature should only be taken in a 2-month-old rectally because that's standardized. We all know today, I talk about this with parents all the time, none of us know how to use those ear thermometers or the ones on the head. It's like one ear is 103, the other ear is 97.6. What do? Average them? I don't know. But rectally, it tends to be much more consistent. And a fever is anything higher than 100.4 degrees Fahrenheit. And that's rectally for those first 2 months. And if your child has that, the most important thing is to call your pediatrician right away. As your child gets older, we can start to tell more about what's going on, and then fever becomes more of just a singular symptom in a constellation of symptoms. So there'll be many times that your child will have a fever in the mix of cold symptoms like a runny nose and a cough, and the doctor will say, no, you're fine, keep your kid comfortable, hydrate them, and you can even stay home with a fever. Because the fever is your body's response. The fever is the way your body's creating an environment so viruses and bacteria don't work that well. And it's your immune system that's creating that. Now, unfortunately, fever can happen for many reasons that your immune system may not want it to happen for. Autoimmune diseases can cause fever. Cancers can cause fever. But the vast majority of fevers in pediatrics are going to be caused by viral illnesses. And this is something I like to remind all my patients about. We don't live in a sterile world. Everyone's like, how did he get the cold? He never left the house. I'm like, you might have, but I didn't get sick. Yeah, but that's because you've seen that virus before. But as we all know, we learned this during COVID, you can spread viruses before you even have symptoms because the virus is just there dividing while your body's trying to fight it off. So the fever, again, is just your body's response. And that's important. Parents will constantly ask the question of, how high can I let the fever go before I have to get worried? Most pediatricians don't like giving an answer for that. But here's what I like to tell my patients. If the number on the thermometer scares you, call me. If your child scares you, I don't even care if the temperature says 99, you should call me on the way to the emergency room. It's not about the temperature. It's about what your child is doing while they have that temperature. Because some kids just have a thermostat set really high. They can get 104 fever and still be walking around as long as it's a viral illness that they're fighting and not something more significant. But most of us do look pretty crappy when we have a fever. I did this in a shorter episode, but I'm going to go quickly over what you can do to help bring that fever down. So if you talk to infectious disease specialists in a hospital, there are many times they'll let people have fever to help them fight illness because that's creating an environment inside the body to help kill off the bacteria. But we don't live in a hospital. And kids don't like having fever. And if they have fever, they don't drink, they don't eat, they don't sleep well. And you need to do those things to fight illness too. So I always kind of balance the two out. I don't want the parent to be nervous about the presence of the fever, but I also want the child to be drinking and resting more than anything else. So if your child has fever, the two tools we have are acetaminophen and ibuprofen, Tylenol and Motrin and Advil. That's like Coke and Pepsi, Motrin and Advil. The doses are always on the back that tells you how much per weight. You can talk to your pediatrician because a lot of times there's a little more leeway than what's even on the bottle, but I would make sure you consult your pediatrician and know your child's weight. That's very important. You can give Tylenol every 4 hours, as long as it's not for multiple days in a row. You can give ibuprofen every 6 to 8 hours. Again, as long as it's not too many days in a row. And the real trick is that you can actually chase the Tylenol or the ibuprofen with the other medicine, even an hour apart. In fact, there's a brand of one of them out there that has both medicines in the same capsule for adults. I would never use that because why would you give two medicines if one works? Life's better off medicine. But if your child has a high fever and you give them Tylenol at an appropriate dose and an hour later they're still smoking, you can give them Motrin at that point or Advil, the ibuprofen brand. And sometimes in concert, those two will help bring the temperature down. That along with a lukewarm bath or cool compresses and making sure the child's drinking will make them more comfortable, and then you'll be more comfortable. The fear that people have is that there are certain things that are attributed to fever. Things like febrile seizures. The word febrile means with fever. A febrile seizure is something that happens in children under the age of 6 years down to 6 months, where they'll have a generalized seizure secondary to a fever. This doesn't happen to all children. It usually happens, interestingly enough, on the very first time they have fever. So it's not like you can give them Tylenol or Motrin and knock it out. When I say the very first time, I mean during a certain illness. So they may have had fevers in their lives, and then they're 2 years old, and they get a new viral illness during the summertime, and before you even know the fever's rising, they'll have a seizure. It is one of the scariest things a parent has to deal with. But in the end, it is not typically a sign of epilepsy or a serious illness for the future, but it is really scary for a parent to see. So when do we have to be worried about a fever? So as I said, parents will come in with babies having fever and saying, could it be teething? Which I like to joke, if you put 100 pediatricians in the room and ask them, does teething cause fever? We all kind of look at each other and shrug our shoulders. But the truth is, that's when kids get all their viruses. And if it's a virus causing a fever or teething causing a fever, this one sounds better. So we kind of allow that myth to exist. There is a physiologic explanation for teething to cause fever, but we really don't buy that. It's really more that it was probably some viral illness that your child's immune system is doing a good job with. But here's when you worry. So when a fever is the sign of a more significant illness, because remember, this is just a sign. It's a symptom that you have based on an illness. The two kind of things I talk about with infection for a parent is if the fever goes for more than 4 full days. Your typical virus is 4 full days of fever. It can be shorter. It can even be a little longer, but I like to say if you get past that 4th full day of persistent fever, we should come back. That's not typical. It may be a normal virus, but it probably deems it time to look at it. Because what we're worried about are secondary infections, pneumonias, ear infections, other things like that. So the other time you get worried about that is if you have a kid who's had a fever for 3 full days, then has 24 hours of no fever, and then the fever comes back. A fever that goes away and comes back after 24 hours isn't typical. Most things don't take breaks. So if you have something starting up again, that's more likely to be a secondary illness or just a second illness. But again, that's probably a good time to go back to your pediatrician. The other reasons to go back with fever are just basically, as I like to tell every parent, and I kind of close every episode with this, if you're nervous, I should be too. If there's something about the way your child's acting during that fever that you don't like, well, we should take a look. Because the last thing you want to do is wait on something that could be getting worse. Now with technology, even a virtual visit sometimes can be reassuring enough. And to me, the most potent tool a pediatrician has is the callback. If you call your pediatrician in the middle of the night because your child has fever, what I like to do is you tell them to give the Tylenol or the ibuprofen, and then you call back in about 45 minutes to an hour, because most of the time everything will be calm at that point, and the fever will come down and the child will look good. And I like to say bad things don't take breaks. That's most of the time. But just because a fever comes down, a kid with a pneumonia is still going to look sick. So if the fever comes down and they look better, that's usually a very good sign. But again, if things aren't looking good, always call your pediatrician for advice. The final thing about fever, again, is to remember that there are times that fevers can be the sign of something more serious. But in general, they're just a normal thing to go through. So again, if it's more than 4 days, if it goes on for 3 days and takes a break and comes back, or there's abnormal things that feel off about your child, those are times you should definitely come in. To control a fever is really to allow your child to have normal activity, meaning drinking and sleeping. Normal activity while you're sick. I don't mean you should go out and play baseball. And the final thing to help not spread the illness is while your child has fever, they really shouldn't be in school. That is when they're at their most contagious, because that's a sign that the war is going on, that there's still a lot of virus or bacteria around, and that's when they're at their most contagious. In fact, during flu season, we like to say you should be 24 hours fever-free before you go back. So fever is also a good sign of when you should stay away from others. These are all good bits of information that tell you how to manage a fever in your child, but the best thing I could tell you is stay calm, and if things don't feel right, call us. Because again, if you're nervous, we should be too. So you should have seen the kid. I had this one kid that was losing it. So in order to calm him down, I had to pull out the GRU. And I went, I'm going.